It was really an opportunity to just learn and become exposed to a whole new field. I had not worked in healthcare at all before I came into the program in healthcare administration. And the School of Public Health, basically, the program in healthcare administration, opened up a doorway to a whole new field that was absolutely superb. And I had an opportunity to participate fairly early on in my career in significant and fascinating management opportunities as a result of the education that I received at this university through the School of Public Health.
When I received my MPH, I didn't have a job. So I had been volunteering on a crisis line for battered women at the time. And I felt that a hospital or healthcare, public health, ought to provide an avenue for victims of violence to receive services.
Yeah.
So I went to one of the local hospitals in the Twin Cities, and I talked to them about starting a domestic violence program. And I, in fact, ultimately did that. It was at Fairview. It's now all over the country. It was called Womankind. The name has changed now, but the goal is to provide advocacy, case management services for victims of domestic violence, and at the same time to train the healthcare providers so that they recognize and identify victims when they come into the healthcare setting.
Well, first of all, public health has become much more complicated. Before public health, in the early days of my career, was one where if you said something should happen, it would happen. Today we live in a world where we challenge science with regularity. We ask ourselves all the time, how are we actually going to make this program, which is obvious to us and one that will clearly benefit the society as a whole, actually work in the community. And so we have many, many challenges today trying to bring programs to fruition in terms of actual impact. And last but not least, of course, is funding. We live in a world today where resources are continued to be stretched and only going to get more so that way in the future. So we've got some real challenges making sure that we ensure the public's health.
The very first course I took was from Dr. Gala Anderson, who was the first dean of the school. And in a way, that was a transformation. I mean, that's what really made me believe that was a fit for me, because he was, well, of course, probably the most brilliant man I ever met, and was what I always said, a gentleman from the old school. He never, well, there were jokes about it, but it's really rather true that he never really said anything bad about anybody. But they always said he had two lists. He had a good list and a bad list, and you could get on either list. And once you were on, you could work up or down, but it was very difficult to transfer from one to the other. And I fortunately did very well in his first course, and I kind of got his attention a little, and that led later to working for him and so forth. But he, the thing about it, that first one, that he would come into class, and and other courses I took from him too, I'm unaware that he ever used a note. Now, I may be wrong in that, but he would just come in, lean on the podium, and say, last class session we were talking about so-and-so, and then he would just launch into the next, and you could have recorded those and just printed them, because they were almost perfect. And if anybody asked a question about where was some more information about this, he could turn to the board and put about 5 citations from the literature up on the board just from memory. Just, you can look up this. And I was just in awe the entire time.
What the School of Public Health also gave me was connections with faculty and other graduates of the school. So in my life with the city of Bloomington, it happened to be the time of the Minnesota Heart Health Program, and Bloomington was an intervention site. So at that time I first met Dean Finnegan because he was leading the communications part. And with that, really discovered the power of communications in creating change in the community, and worked with Gene Forrester on the tobacco part, and Henry Blackburn and Russell Lupker were also involved.
When I was going through the graduate program in 70 and 71,
there was a principally embrace or focus on acute care activities. And I'm a graduate of the Master's in Hospital and Health Management part of the School of Public Health. It's quite clear now that that early focus on communicable disease has evolved very dramatically now into how to manage and to invest in the control of chronic disease, which puts us in the challenging arena of behavior modification. I've worked on that now with a number of ministries of health as well as programs here in the U.S., and it's a big challenge, but it's intellectually quite stimulating.
Here the motivation and the values are such that it makes a contribution to society, and I repeat that over and over again, because that's the driving force. It's like medicine, it's like nursing. It is, what do I do to contribute to society? And that's the joy. And what we've done here in the School of Public Health is paramount, and one of the leaders of the nation always has been and is. And it's a joy to be a part of it all. And I'm very proud of the School of Public Health. Honored to be involved, and I graduated from the program 62 years ago. I'm 87.